Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive, where we rehab your mind to revive your body. Numbness and tingling down your legs or sciatic pain from your back? We have a simple exercise, the nerve floss in sitting while at home or work coming up. Before we get to the exercise, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. We appreciate your support. So let's jump to our nerve behavior scale. We have these different symptoms that go along. We have healthy, pressure, stiffness, fatigue, hot, cold, pain, tingling, numb, paralysis. When you start from a healthy nerve, a healthy NED, and you start going down that degenerative process where the nerve is starting to get pinched, there's a little bit more adhesions that run along these nerve sheaths. What happens is you start going from healthy, then you go from pressure, stiffness, fatigue. That's when the encasing is pressurized a little bit more. Then you move from hot, cold, where you have some temperature changes. Then you move from temperature changes where sometimes people feel burning. They progress into pain, or they digress into pain. Then you have tingling, which is the start of something really bad. A lot of times people will ignore the pain and the hot, cold, and the pressure first, but once you get to tingling, then that pins and needles moves to numbness, and then I like to use paralysis as a general free term. That's when you've gotten really bad. You need to seek some help from a professional physical therapist or an orthopedic person to get that started, to get some remediation there. But what we want to do is, if you're getting better, you're going to move from paralysis to numb to tingling, back to pain, hot, cold, then you're back to pressure, stiffness, and fatigue, and then back to healthy. So it almost seems odd if you go from numbness and you go from pain. A lot of people will be pretty upset, kind of freaked out, but that's actually a good thing if you're moving from that one end of the spectrum to the other. So why is this going on? Are we really treating the nerve? We're probably not. We're influencing the sheaths that keep it from sliding and gliding like oil and water. These adhesions along these tunnels adhere to the sheath that hold the nerves inside. It's because of these pressures of the nerve, they're stimulating and pinching these nerves too much, and we're messing with our circuits. We've essentially short-circuited ourselves. What we need to do is prepare our body for the seated nerve floss. So let's get to the flossing. All right, this is how you set up the seated nerve flossing. What you want to do is get your hands, you want to put it behind your back here and your tailbone area, pelvic area. You can do this exercise in both sit or slouched or extended. So we'll start with the slouched one. You're gonna get right through here, and let's pick your right leg. You're gonna go right to the tension here. You don't wanna go past it because you'll feel pressure here, but you feel tension here is okay. That's also something you can note. You wanna go right there and back, there and back, until it starts loosening up. In a perfect scenario, it gets straighter and straighter. So you keep your head down, you keep yourself slouched. We're gonna move this to a sideways position here. I'll use my other leg, but slouched here, and wanna keep moving it. You don't wanna force it. Forcing it puts a lot of tension through that nerve, but you're just gonna go right here. And keep in mind our symptom behavior scale. You don't want that numbness or tingling or any worsening of that scale, or when it goes down that degenerative process. You really want that ability for it to start loosening, that symptoms to turn into something more like pressure. And if things go well, it starts loosening up just like this. Let's try that in extended sitting. You can try that as well. You can do it this way, where we just find that tension. We'll do that with the right leg, and you just work that out. It doesn't take that long if you just follow along. You can do it this way. So some people are more tight one way or the other today, and I'm saying today is it changes sometimes from day to day. Today, being straight is really tight on this right leg, probably both legs. And slowly it's lengthening. That's how you know you're getting better. I don't have any nerve symptoms, thank God today, but I used to. But now it's much better and it just freed up. So let's do it with the left leg. Here, just pressure on, pressure off. Pressure on, pressure off. Pressure on, pressure off. And that just freed up. And there's no pressure here, and there's way less pressure here. So that's how you do the seated nerve flossing. Please give this exercise a try, see if it helps. Let us know what you think and leave us some feedback in the comments box below. Once again, please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.